Audrey was born, I was overjoyed. I was really happy, and I had an addition to my family.
Somewhere over the rainbow, way up high, and the dreams that you dream of once in a lullaby. Oh, somewhere over the rainbow, bluebirds fly.
At 7 weeks old, I started noticing these tiny vertical upticks. They were sporadic, they'd only happen occasionally, and I almost wasn't even sure that I saw them.
Someday I wish
I continued to watch her, but by the time she was 11 weeks old, I was convinced that she was having seizures.
where trouble melts like lemon drops high above the chimney top. That's where
We took her to the emergency room and were admitted pretty quickly. They immediately started a 24-hour EEG to see if she was having seizures. That came back negative, so we moved on to the next possibilities. We started hearing words like neuroblastoma and paraneoplastic syndrome and oxyclonus myoclonus. We had 2 CTs, an MRI, and her first of 3 lumbar punctures. All of her scans were negative. Most of her labs looked pretty good. The only lab that was a little bit off was her glucose levels in her spinal fluid. Genetics got involved at that point, and they talked to us about something called GLUT1. We sent off a genetic panel specifically looking at the identified gene for GLUT1 transporter deficiency.
The dreams that you dare to, why, oh why can't I?
Neurology and genetics did both discuss with us that Audrey's eye movements were very atypical for GLUT1, and the fact that her glucose numbers in her spinal fluid were not as low as are typically seen in a person with GLUT1. Hers were in the 50s, teens and 20s are what's usually seen. After 9 days in the hospital, we took Audrey home. Several weeks later, we got a phone call that she did not have the genetic mutation for GLUT1, and at that point, GLUT1 was essentially taken off of the table for Audrey. In the months that followed, we were asked to follow up with neuro-ophthalmology. We visited Emory. The doctor there thought that she had oxyclonus myoclonus syndrome. We also visited Vanderbilt. The doctor there suggested that we do a workup for alternating hemiplegia of childhood. In the meantime, Audrey's eye movements continued to get worse. She was not getting any better. At that point, neurology decided to send off a whole exome sequencing for Audrey, so we waited several months for that to come back. In the meantime, we did another set of scans. We qualified for early intervention services through the state of Alabama, and we also got on the waiting list at the Bell Center, which is a private early intervention center here in Birmingham. Oxyclonus myoclonus was really the main syndrome that was on the list of things for Audrey, but once our second round of scans came back and they did not find a neuroblastoma, our neurologist kind of started to waver and say they really didn't think that's what it was. At that point, we got a second opinion with an oxyclonus myoclonus specialist at Boston Children's. His opinion was that because of the early age of onset and the fact that we had not been able to identify neuroblastoma with any of Audrey's scans, that it was probably not OMS. And all the while, I kept coming back to GLUT1, and I kept reading, and I kept researching, and I kept digging because it bothered me that her glucose numbers in her spinal fluid were low, lower than average, lower than normal. We had a couple more lumbar punctures, which yielded the same results. Those glucose numbers were 50 and 48. Now, by this point, nothing had changed with Audrey. Her eye movements continued. It was really more and more frequent and more often, and it was more consistent throughout the day. Audrey was not rolling over back to front or front to back. Her pediatrician was concerned, but neurology really continued to tell me that she was meeting developmental milestones and was where she should have been. I continued to push and push to talk about GLUT1, and there was a lot of pushback when I brought up GLUT1. I had a couple of very specific research articles from people who dealt with GLUT1 on a daily basis and were currently actively doing research on GLUT1. There's a small population of people, 10 to 15% of people who apparently don't have seizures, don't have this genetic mutation, have higher glucose numbers in their spinal fluid. When I presented this to neurology, it was dismissed. I was told that that is not what the researcher was saying and that she just really didn't have GLUT1. Neurology also brought up a possible diagnosis of paroxysmal tonic upgaze, which they basically said you just kind of wait and see, and maybe by 4 or 5 years old, she might grow out of it. That was not okay with us, so at that point we stopped seeing that particular neurologist. We spent a couple of months really without being followed by neurology. In that time, I was able to actually get in touch with the researcher at the University of Texas and get him on the phone, and we had a conversation about where we were, how Audrey was doing, tests and scans that had already been done. And I asked him, is this what you're saying about this population of 10 to 15% of people? And he said, that's exactly what we're saying. They think the genetic mutation is there. Our technology is just not advanced enough to be able to pick that up. I said, what do I do? He said, you've got to get a new neurologist. I'm happy to see you, but it may be better if you find someone local. So we had the help of our developmental pediatrician locally, and she got us in touch with another neurologist who also had a background in metabolics and genetics. So we felt like she was going to be a really good fit for us and Audrey. Audrey also started doing some other kind of odd behavior, odd motor movements. She did some odd things with her tongue. She started doing some odd things with lip smacking, head jerking. There was just a progression of things we started to see. Her eye movements also changed. They started to become much more pronounced, much more noticeable. They started to hang or almost get stuck at times. And nobody really could tell us why. Nobody really knew the answer. Not neurology, not neuro-ophthalmology, genetics. No one had an answer for us, or really even any thoughts or opinions on what to what to do, where to go from there. Audrey did start to make progress with early intervention. She received physical therapy and occupational therapy, and then of course we worked with her at home, and we did start seeing progress. And she was still such a happy baby. At no point during her journey did she even seem like it bothered her. She was just incredibly happy and brought so much joy to everyone around her. But unfortunately, the eye movements continued. The motor movements continued, and they just seemed to be getting worse. Our new neurologist listened to me, and she agreed that maybe GLUT1 was something that needed to be revisited. So she was able to get in touch with Dr. DeVivo, who originally found GLUT1 and is currently doing research at Columbia on GLUT1. She, our neurologist, got with his staff and figured out a way to send an uptake assay, a sample, to Dr. DeVivo at Columbia in order for him to be able to tell us exactly how much glucose was crossing into her brain. We were also accepted into the University of Alabama at Birmingham's Undiagnosed Disease Clinic. Audrey was more than a year old. We had no answers. We really had no next steps per se. And they accepted her and really did a thorough workup and reviewed everything that she had. And they agreed that our next step was to have whole genome sequencing completed. And that is still pending. In the meantime, Jason and I started really being moved to look at doing some advocacy with a local group called Alabama Rare. We got involved with her. We went to Montgomery. We started advocating for people with rare disease. We did get results back from Dr. DeVivo at Columbia, and he was able to tell us that Audrey is actually passing 66% of glucose across the blood-brain barrier, so that is the amount of fuel that she is actually getting to her brain. We're still really in the gray area, though, because 60% or less is diagnostic for GLUT1. So she was still kind of in that in-between zone. Dr. DeVivo did recommend, just given all the testing we had done and all of the kind of red flags that were pointing to GLUT1, that giving the ketogenic diet a try might be in Audrey's best interest. Our neurologist agreed, and we scheduled that for a couple of weeks later, inpatient, to make that transition to the diet to see if it helped Audrey. Through our advocacy efforts, we had the opportunity to meet some people from Global Genes, and Jason and I made the decision to travel across the country from Alabama to San Diego to attend the Rare Disease Patient Advocacy Summit, where we made so many connections, learned so much about neurological, metabolic, genetic disorders, and then kind of what to do to share Audrey's story. We then were admitted into the hospital to begin Audrey on the ketogenic diet. Lots of monitoring, lots of checking blood sugar, making sure levels are okay, checking ketones. But the transition was fairly easy, and pretty soon thereafter, we saw a difference in Audrey, and her eye movements started to slow down. They just weren't as pronounced. They just weren't as visible as they had been. The difference that we saw was really amazing. We just did not see as many upticks. We saw very few rolls, and we saw the benefit of doing something like a ketogenic diet. I revamped kind of our meal plans and really got prepping down pat, and just started every weekend making meals that were specifically tailored to her ratio.
Hi.
How are you?
Dad.
You're great. Show me your nose. Nose. Where's your mouth?
Dada.
Right there. Where's your neck? Neck. Neck. Very good. Neck. Where's your ears?
Dad.
Right there. You have 2 ears? Since starting the ketogenic diet, we have been able to dismiss early intervention services through the state, and Audrey still attends the Bell Center twice weekly, but she has been moved to more of a typical in a group class. Our message to you in creating this video is just don't give up. Don't give up. Don't take no for an answer. If your gut is telling you that there is something that is off, there is something that is not right, you keep pushing and you keep pushing and you research, you ask those questions. If people don't know the answer, find someone who does. You don't give up. I cannot imagine where Audrey would be if we had said okay to, I just don't think it's GLUT1, or if we had said okay to, let's wait until she's 5 and see if she grows out of this. You keep pushing, you don't give up. You stay strong for the person that you are advocating for. Audrey's story is one that needs to be told. Audrey's story is one that needs to be heard. More doctors need to be educated about GLUT1. There's no telling how many families have gone undiagnosed for years just because of lack of knowledge, because of lack of willingness to research, to dig, to think outside of the box. Audrey is a very atypical presentation of GLUT1. If you look in the medical literature, what you're reading does not describe Audrey. The eye movements are different, the head movements are different, her glucose number in her spinal fluid is not as low as originally thought for a diagnostic criteria for GLUT1, but it's there. The medical literature is constantly changing, and our prayer in creating this video is that more doctors will educate themselves on GLUT1. More parents need to research GLUT1 if you have a diagnosis that just is not quite right. We want Audrey to be an inspiration to people in the medical community. We want Audrey's story to be one of hope. We want Audrey's story to be heard, to encourage families, doctors, and people who are touched by rare disease to keep searching, to keep believing the answer is out there. Ours was.